Hello, my name is Dr. Ashley Parks, one of the professors who have the distinct pleasure of teaching the 2110 course. And I am here to walk you through an introduction to health systems organization, a view of the course as a whole, as well as several pre-recorded lectures throughout the modules. And then for this particular section of the course, offered in summer 2023, we will also have live sessions on Wednesdays. So I'm really excited to get started and share with you about health services administration and healthcare delivery. Again, I'm Dr. Ashley Parks. My physical office location is in Leon Levine Hall on the 5th floor in 540Q. And this is my number, and of course my email address is parksav@appstate.edu. The Zoom link for office hours and meetings is provided here, and we have those optional live lecture office hours. I'll normally start off with a short lecture and discussion and then leave time for questions every Wednesday at 6 p.m. If there happen to be a Wednesday where we're not going to hold office hours or a holiday or an event, I will let you know. I am also available to meet with you at other times throughout the week, of course. As far as what you'll gain from this course towards your learning in the HCA degree, this course will help you develop introductory knowledge of the healthcare environment, the political, regulatory, social, environmental, organizational landscape that we're dealing with. You'll also develop a basic understanding of healthcare or of the healthcare industry as a whole, as well as different types of organizations, what I call settings, often sometimes referred to as locations, like hospitals and health plans and long-term care, ambulatory or outpatient care. I'll also introduce you to the quality, patient satisfaction, patient experience side of things, as well as cost and some of healthcare finance. We'll also discuss and prepare to assume different management roles. So we'll talk about things like staffing and managing shortages of staffing and dealing with other complex problems in a healthcare setting. You'll also be introduced to measures of health and health status in the population. So we will talk about different data and information about the health of residents in the United States. As far as our course as a whole, this course is designed to provide an introductory understanding of really four main components. One is the various forces, financial, political, right, the policy landscape, different things that shape the US healthcare system, social determinants of health. We'll also talk about the functions, missions, and structures. So the purpose, the function, the driving force behind healthcare providers and organizations. We'll also look at different issues relevant to the future of healthcare and the role of managers in the United States. As far as our course objectives, we have 7 distinct course objectives, and you'll notice that in our course schedule, I map those to each module. So you can see the course objective is covered in the module, what the objectives of that module are, and then what the assessments or assignments and activities are that tie into that. So you really know, okay, in this module, I am going to be comparing and contrasting the organization, financing, and cost and outcomes of the US healthcare system, right? I'm going to be talking about what it means to be paid fee for service versus capitation. You'll be able to see these brought to life a little bit more. I do have a specific course communication policy that's outlined in the syllabus, but I want to make sure the information that's in bold and italics at the top here is really what's key. I want to talk with you. I want to provide you guidance and support and mentorship as you start your career as a health services administrator, as you work through the process of being a student here at App. I really want to see you grow and succeed. So keep that in mind. If you join our Wednesday evening sessions, if you schedule time to talk with me, that's the best way to get plugged in to having a resource and someone that cares about you, wants to meet with you and work through that. That being said, I will be posting weekly announcements with our course material, reminders. I'll be in Zoom Wednesday nights at 6 p.m. And then if you would like to meet with me outside of that, just send me a few times. Say, Parks, can you meet with me on Friday afternoon? Let me know and I'll do my best to accommodate. I ask that you give me 24 hours notice on those requests to meet with me during the week, just because if you send me a request late the night before, I might not get a chance to respond to it if I have a day full of meetings the next day. So we just want to operate with a little bit of grace there and flexibility with one another. As far as the grading policy, I will get grades back to you within 7 days is the plan. A lot of times it's going to be quicker, right? Especially with discussion boards and things, you should see at the beginning of the next week, your grades start to populate. But when you are writing longer papers, or if it's a busier week, maybe during the summer, I'm visiting internship sites, I may not be able to look at something that day. So it might go a day or two. So just keep that in mind. I will do my very best to respond within 24 to 48 hours to email. Usually it's either pretty instantaneous or it's a day, because either I'm at my computer that day and I'm seeing emails come in and I'm responding, or maybe it's a day where we're meeting with accreditors, or I'm traveling, or something's going on. Maybe I'm at an internship site again, or working on a research project. So I'm just like many of you, we have jobs, we have things going on, and you're a big part of that for us faculty here at App. But I just ask that you understand that as a faculty member, not every day is the same for me. And so you are always important each and every day. And that's why I ask, give me a day to take a look and respond thoughtfully to what you reach out to me about. Our text, we use the She and Sing text. It's the essentials of the US healthcare system. I have been using this text in older editions for 10 years now, since the beginning of 2013. And it's a really great text. It provides a really broad stroke overview, but a lot of really great details about different types of systems and integrated care. So I really enjoy it, and I think you will too. We also have several other posted, what we call handouts, but it might be an article, it might be a website, but readings. And there are a few videos that are posted in As You Learn for you to review. I will let you know if I think something is supplemental or optional. But in most cases, it may feel like, oh, this is just another 10-minute video, but it takes whatever content we're exploring and adds some depth or context to it. And I want you to have that additional information. Again, we have those optional Zoom sessions, and I'm a little redundant in this presentation just because I want you to know and not get confused. This is the link for those Zoom sessions. And the purpose of this discussion is for us to get to know one another, for me to share a piece of content each week or set of content, but also for us to check in with where you're at in the course, give you a forum. If you don't feel comfortable scheduling time or it's a busy week, gives you a quick forum to hear the questions you have get answered. But more importantly, in many cases, you don't even realize you have a question until you hear a student who's maybe worked a week or two ahead who has a question. And then you go, oh, I would have wanted to know that too. So it provides a great opportunity for that shared learning. Also, your final project in this course is a group presentation. And so these Zoom sessions are going to serve as a great way to get to know folks and their personalities before you have to select a group. As far as the course assignments and deliverables, these are our key assignments. So I said you have a group presentation that's a group deliverable. These are the individual deliverables. So we have 5 interactive online discussion forums. So you'll be posting that yourself. We have 4 reflective journal entries, 3 exams, and 3 short write-up papers. And then we'll have some online activities amongst those, short, no-value quizzes, some pre-module check-ins, just to give you some added exposure to the coursework. These, again, are the individual assignments, but we also, again, have that group work. So the course will use team-based learning, and you'll work with a team to prepare that final presentation. Each team member is expected to contribute actively, so keep that in mind. There will be a team member assessment form or ranking form for you to complete. Now, as far as how your grade will be calculated, 60% of the grade is exams, which feels very point heavy, and I do realize that. Now, with the intent behind the exams, I really want to make sure that everybody gets a chance to see and understand the content, participate in learning, but also have a chance to demonstrate that understanding. And so the exams will be short, multiple choice exams, and they will be posted and available for a full week within the module that they're due. And if you have questions about those dates or what that looks like, please watch the course navigation video, because you'll also kind of see where that's at in the course and get a better feel for it. The assignments and activities. So you have journal entry papers, these reflections. You have 4 of those at 20 points each, and those are just short 250 to 500 word reflections. And then you have 3 short write-ups. These are 40 points each. And these are meant to be a chance to quickly reflect on a topic as well, but with a little more intentionality, where you're actually devising a solution, making a recommendation. For example, short write-up 3 is about dealing with challenges with shortage of clinical staffing. What would you do to prevent having a staffing shortage? What would you do to mitigate or address that? That requires a little more thoughtfulness and intentionality than just reflecting on a topic in general. Your final assignment is a final presentation, and that's worth 10% of your grade, with the intent that it is worth a chunk. But I do realize it's group work, and that can sometimes get us a little worked up working in groups and partnering. So I want you to realize it's not a huge piece of your grade, but it is large enough to where it matters and it's impactful towards your final grade. There are also online discussion forums, 5 forums each at 20 points each, for a total of 10% of your grade as well. Now, I want to quickly walk you through the modules. We have 5 modules in the course. The first module is an introduction to the U.S. healthcare system and systems thinking. And that is available May 30th through June 11th. So our first 2 weeks in the course will give you a good broad overview of the system. And you'll notice that in this first 2 modules, or this first 2-week module, rather, you'll have a pre-course questionnaire to fill out really quickly. Just, I think, 2-3 short questions. You'll also have a syllabus quiz to make sure that you read and understand the syllabus. Those are due within the first week of the class by June 4th. You also are asked to put together a brief slide about yourself, a PowerPoint or a Google slide, and post that to the introduction discussion board and get to know some of your peers. That's also due the first week of class. By the second week, I'll be asking you to comment on our first content discussion board, which is on health equity, and work on a reflection journal entry talking about systems in healthcare. And then lastly, you'll also have your first short write-up essay that is due at the end of that week on June 11th. You'll notice the modules take a very similar format. Most modules have a discussion board or a reflection entry, sometimes both, as well as sometimes a short a short write-up. Module 2, which runs the next 2 weeks, is really focusing on healthcare providers, but we're also going to talk a little bit about individual, community, and public health, kind of taking the thread from that broader discussion in Module 1 into healthcare providers in Module 2. We will have an exam at the end of Module 2. So after the first 4 weeks in your class, you will have an exam because we only have 10 weeks to work with this summer. So exam 1 will be offered, and that will be available the full week from June 16th through June 23rd. Next, we have Module 3, which really dives into the financing of healthcare, the different settings in healthcare, and we'll be looking at chapters 5 through 8 of the Sing text in order to do that. A lot of intricate pieces here that we'll be talking about. Things like the difference between capitated payment and fee-for-service. We'll be talking about different types of health insurance and Medicare and Medicaid, understanding the difference between primary and specialty care. We'll also be talking about things like concierge medicine and patient-centered medical homes, so alternative care methods. In this module, you will have a reflection entry due, reflecting on the Healthy People 2030 goals that we'll go over together. You'll have an online discussion forum where you will look at capitated payments in healthcare, and you'll have a short write-up reflecting on concierge medicine. After those first 6 weeks together, we move to Module 4, and Module 4 is really diving into healthcare quality, what we often refer to as the triple aim, which is cost, quality, and access, and public policy. And so you'll have an online discussion looking at provisions of the Affordable Care Act, what is really called the Patient Protection and Affordable Care Act, or PACA. Many of us know of it as the ACA. So I'll be asking you to reflect on that and consider a provision of the ACA to talk about. You also have a reflection entry looking at an article called Inequality and Quality, looking at how quite often we measure a lot of quality in the United States, a lot of quality metrics, but we don't have a lot of diversity or disparity related measures in that. So we look at what percentage of our population get central line associated bloodstream infections and pressure ulcers and are satisfied in their care, but we don't necessarily look at if certain populations are having a better experience compared to others. or better outcomes, which, as we know, there are considerable race, ethnicity, and socioeconomic disparities that exist in our health system. Again, you'll have a short write-up on staff shortages. So you'll be assuming the role of the health services administrator, reflecting on staff shortages in healthcare. And then you'll have your second exam, and that is during week 8, really. So the second week of our 4th module. And that will be covering a lot of chapters, but it is only 25 multiple choice questions. So you have an opportunity to showcase your competency and understanding in all the areas across this module. Lastly, we have Module 5, and Module 5 is really future-oriented. We're reflecting on the future of the U.S. healthcare system as a whole. We'll talk more about financing and reimbursement mechanisms again, and then we'll look at how there could be changes in financing, policy, external factors, needs of different populations, socioeconomic conditions that could affect our health system. There's quite a few supplemental readings that are posted in our module now, as you learn for this module and others, so keep that in mind. But for this module, you'll be doing an online discussion forum post where you're kind of pulling it all together and talking about what you think is the single largest challenge for our health system. You'll also be submitting your final presentation for your group by August 5th and completing our last exam. Not a cumulative final. There's a study guide posted so you can take a look at key information. So I say not a cumulative final. It primarily covers chapters 13 and 14, but there is some reflection back. These concepts build. So you may see a question and say, this is really chapter 8 because chapter 14 builds on chapter 8, right? There's that time. So keep that in mind. So professionalism in our program is incredibly important. HCM in healthcare management, we are a professional degree. It's important that you participate in our course to the full extent. Now, these are the standard professionalism expectations for our program, so you'll see them in a lot of our classes. I do want to say online participation is important, but our weekly sessions are not mandatory. If you attend, you will do much better in the course. But I do realize that many of you take an online asynchronous course, and it is posted as an online asynchronous course in Banner so that you have flexibility. Many of you may be working Wednesday night, and to hear me say, what a great impact it would have for you to attend class probably doesn't feel great. So keep in mind, I think it's very important for you to be there. However, I will be posting recorded lectures, and you can always meet with me at a different time. So that is an offer that you should certainly take up as well if you're doing other things and unable to attend with us on Wednesdays. As far as important resources, this is a slide that contains some information from our syllabus that I think is incredibly important. It's important that you realize we have a counseling center. If you are going through anything or know anybody that needs support, you need support, social, emotional support, please visit the counseling center. They are wonderful humans who would love to talk with you and provide you with support, a chance to vent, discuss your thoughts and feelings and what you're going through. We also have a link here to the food pantry. The food pantry is in 542G, which is right down the hall, actually around the corner from my office. A wonderful resource. If you feel like you certainly could use a resource, if there's some days where you say, I don't want to make a big deal about it, but I don't know when I'm going to get a chance to meet my class. Maybe you're on campus. That is a resource for everybody. Regardless of means and what's going on in your life, I highly recommend, if it would be helpful to you, stop by and grab something from the food pantry. That is exactly what it's there for. Now, I'll use these slides or something similar to it when we meet to discuss our course overview, and we'll get a chance to introduce ourselves. But for this posted recording, I want to take a moment and introduce myself. So I'm Dr. Ashley Parks. I've been working in health services management and healthcare research since 2003. So it's 20 years now, which is incredible. I've been teaching for about 10 years. I have a lot of different certifications. They're not all listed here, and I don't always list them in the syllabus, but I have over a dozen healthcare certifications. I have a doctorate in public health, a master's in public health. I have an MBA and a master's in technology management. I love learning about healthcare. I'm a lifelong learner, and I love sharing that with all of you. So if anything, pay attention to the bold section at the bottom. If you have specific questions about continuing education, opportunities, certifications, experience, please reach out to me. At the bottom of the screen, that's a picture of me and a former student and alumni who's given me permission to share. That's Fatima, who is an alumni from another program I taught at. And she is just a fabulous human being sharing her research about methamphetamine and suicide risk. And it's right next to a poster shared by a former alumni of another program, Nicole, who shared about competencies for individuals working in the public health workforce and their confidence in the work that they're doing. Really cool work that's done by our students and that's done by students everywhere. And I have several projects that I'm excited to share from app students during our semester together. As far as my background, I've shared with you the technical details, but what you need to know about me is what's on this slide here. I believe in humanity and shared experiences. I believe that everybody's journey is different. Everybody's barrier is different. I couldn't even begin to know what you're going through, what you have on your shoulders. I used to share a lot about my background. I'm a cancer survivor. I'm a mom of 3. I'm a working professional. And I will share sometimes because I feel like it's good to feel humanity, but I'd rather hear more about your background. So you'll notice I'll open the door more for you to share. But the reason that's important is we need to take a moment and acknowledge ourselves as human beings. We're not just cogs in a wheel in an online class. If you get stuck and need something, you have my phone number. Now, do I always sit at my desk? No. You may have to leave a voicemail sometimes, but I will always call you back. I will always be there to talk. So keep that in mind. That open door exists. And sometimes, it's going to take me 24 hours to get back to you. Or sometimes I may send you a resource or advice that maybe isn't helpful. But most of the time, just having someone to talk to is helpful. So keep in mind that I will do my best to do that. This is one of my favorite quotes. It's from a movie, but it's the more you know who you are and what you want, the less you let things upset you. I get a lot of outreach from students and, 2 a.m. emails, the quiz shut down and I didn't know what to do and I'm panicked and I'm crying and, I'm late for work and this thing happened and I got in a car accident. It's just like 5 things in an email. It happens. Breathe, okay? If you need support, if something doesn't work in the online system, reach out to me. Reach out to me and then know I sent the note. Parks will respond. There's nothing I can do about it right now. It's not the end of the world. Technology challenges happen. And I'll get back to you. We'll work through it together. Going through what I've been through in my life, dealing with cancer and other things and body training. I have 18, 16, and 4, so all things, right? Everything that I've dealt with as a human being, everything that you've dealt with as a human being, what we're dealing with in this class, we're only here to share and learn and grow in this content so that you all can be successful administrators. And part of that is also developing an understanding of prioritization and time management. And so I'll be here to hold you accountable, but I'll also be here to support you. And so keep in mind, we're in this together and hopefully getting a chance to see me and talk to me in those live sessions and see me in this lecture will give you that comfort level that we're in this together. As far as questions, reach out. I put my email on the slide because just another reminder, in case you're watching this and you have an emergent question, send me a note. But again, you can call, you can stop by. I'm not always in my office, especially during the summer. I do a lot of research during the summer, a lot of site visits, work with a lot of different clinic sites. But I'm here, I'm online, I'm listening. So just reach out and we'll talk. All right, well, thank you so much for listening to our brief overview of the course. If you haven't yet, please also click on the video that goes over the course navigation, how to navigate the course and as you learn. That has a little bit more of the nuggets of details on assignments because I can show you them. So take a quick peek at that next. All right, thanks everybody.